My name is Danny Clayton, and it is an honour to talk to Dr. Jenny Cook, fertility expert and just all-around incredible person. It's an absolute pleasure. Thank you for having me in your home.
My pleasure.
I have so many questions.
Go for it.
So I hope you don't mind me just...
No, let's get into it.
Now, when it comes to male fertility, it's something that doesn't seem to be in the open. Certainly not as much as female fertility. Why do you think male fertility is a conversation that we aren't having?
I don't know what the reason for that is. Fertility has been just considered to be the woman's domain for a long time. It's a female problem, but like it takes two. It takes an egg and a sperm. I suppose for a female, for a woman, there's a gynecologist, there's a female fertility specialist, and I don't know that we've got the equivalent for men. I don't know that it may be a reflection of the fact that men don't talk about their health as much. Male health, male fertility has just not really been big on people's agenda.
Now, I have got plenty of questions because I just got married. The conversation about fertility has been coming up a fair bit in my home. Now, if you're going to talk to somebody, a male, who is preparing themselves for that journey, what would be at the top of your list besides stop drinking and stop smoking and doing drugs? Those obvious ones. What are some of the things that maybe men don't think about?
I talk to them about having a balanced diet, and the one that we most commonly recommend is the Mediterranean diet, which is high in good fats and low in carbohydrates. To maintain an ideal body mass index, so I mean the weight for height, it should be about 20 to 25. That's really just a part of just general health. I also ask them about their exercise levels, and I always say everything in moderation. Anything to the extreme can be detrimental. We know that it can be detrimental if you do a lot of cycling, for example. Some men can do a lot of exercise and it's absolutely fine. So really the critical thing is to do a semen analysis. And if that is within the normal parameters, then whatever you're doing is okay. If there's a problem on that, then I tend to delve a bit further to see, well, what is causing that?
Okay, I really want to get some, more clarification on exercise and what you would consider too much exercise. I mean, I live in Bondi, and too much exercise is a sentence that doesn't exist there.
Yeah.
And particularly amongst the HIIT community, the high-intensity interval training community, that's like a cult, a religion there. What would be your definition of too much exercise?
I don't have a definition of that. There is very little that's been published in male fertility. That may also be one of the reasons why we don't talk a lot about male fertility. We don't know a lot about it. We haven't done a lot of work on it. What it is largely accepted is in a man who has underlying issues with the quality of the sperm. If he was to exercise too much, that can lead to further problems. There has been some evidence, and I'm going to have to say it's all unpublished, that in men who run a marathon, they can completely wipe out the sperm from the peripheral ejaculate for several days afterwards. It does come back, but it's in men who have underlying sperm problems that are going to be most impacted by that. And it may not even just be running the marathon. It might be the serious training that they do beforehand. The vast majority of men who have completely normal sperm health are going to be absolutely fine. I would struggle to give you an exact definition of what is too much. I think I have to say, if this is having a negative impact on the quality of the sperm, then we need to look at what it is. And exercising too much, overheating, spas and saunas might be what's doing it.
Now, whenever a question about health, particularly in the fitness parameters, they can be quite incendiary in regards to people having opinions. So there are a lot of what I'd call internet experts when it comes to fitness and health online. And when you're discussing things like running marathons being quite bad for fertility for males with that kind of amount of research, is there any research that people are trying to counteract what you're saying? Are they saying, look at what we've got to prove that you're wrong?
Probably.
Okay.
Probably. I would say that a lot of it is probably sensational. Can I stress, I'm not saying that a lot of exercise is bad for everyone. I'm really not saying that. It is in a group of men who have got poor sperm to start off with, they can run into even more problems if they're overworking their body. More work needs to be done on it. I have spoken to a colleague of mine who has a special interest in sperm function, and she's also admitted that there is very little published on it. We know very little about male fertility.
So when it comes to not having enough research and not having enough papers to cite and look to, how do we change that? Why isn't there enough information published about male fertility?
We talk about it like we're doing. We open up the conversation on male fertility. We gather an interest from a group of, from the wider community. We show that there is a lack of information there and that there is a real need to do more work here, and so we can find out more about that area.
And some of the information that has been published, or at least made available to the public, can sometimes be quite alarming. And it's difficult really to know what we should be reading and what should be taken quite seriously. So one of the research papers was suggesting that since 2000, I think they did it in 2022, that they suggested that male fertility had dropped by an alarming rate of 50%. And that's quite a serious number.
True. That's actually true. That's absolutely a fact. So in the 25 years that I've been working in the area, we follow the guidelines that we follow for semen analysis parameters are put out by WHO, the World Health Organization. And in the time that I have been doing it, the parameters that we say are equivalent to a normal semen analysis have dropped. And there's been a lot of theories on why that is. So what is considered a normal semen analysis 25 years ago, the parameters have dropped to what we now accept is a normal semen analysis. There's a lot of theories on that. We know that men who carry their mobile phones in their hip pocket, you're looking at me like you haven't heard this.
Oh, I just think my phone is in my hip pocket. Unless I want to get it out.
You know what? Again, I have to stress, it's not going to affect everyone. The only way to know is to have your sperm tested. It is known that for a large group of men who carry their phone in their hip pocket, you'll find more issues, they'll be having more of a negative impact on the semen analysis than the men who carry it up on their belt. Fact. Fact.
So from my understanding, it takes 64 days for semen
3 months.
Three months.
It takes 3 months for one sperm to be produced. So any change you make, you see the effects of that 3 months later.
Okay, so let's say in 3 months' time, you're a gentleman and you're considering trying for a baby. What would be those things? What would be the list of things that you should do in preparation?
Okay, you asked me that before. I ask everyone the obvious about smoking or vaping, and I get them all to stop it. Yep. For alcohol, look, to cut back, you're meant to drink to maintain optimal fertility. It's meant to be 3 or fewer drinks per week. Exercising to a moderate amount, but I have to qualify that by saying get your semen analysis tested, and if there's a problem on it, you need to address your lifestyle. Maybe you're exercising too much. If it's normal, whatever you're doing is fine. If there's a problem, is it spas or saunas? Steroids are bad. Testosterone is bad. They are the main issues. If you've got an abnormal semen analysis, there are certain supplements that you can take to help with that. And some men will take that anyway when they're looking at trying in the 3 months beforehand. Anything with antioxidants in it, sperm likes antioxidants. So it's lots of green vegetables, a handful of walnuts per day, Menavit, no, all true, Menavit and coenzyme Q10. And I see it happening. If I do a test and it's abnormal and I intervene and get men to do that, we test again after 3 months. I can't say 100% of the time, but maybe 60 to 70% of the time we see an improvement so that it goes back to normal parameters.
Wow. And you're talking about testing. It seems like this is something that you're quite passionate about.
Yeah.
And is this something you'd like more people to do? Do you want more people to go out and get tested?
Yeah, they should. It's it's a simple test. I don't need to go through and describe the specifics of it, but the places that do it are very respectful of what's going on. Some men would choose to do it at home and bring it in. They just need to have it analysed within an hour. It's a very simple test to do, and it provides very useful information. If you're unwell, one of the first things that you're going to see an abnormality on is the sperm, because you might say it's non-essential. Your heart, your lungs, your brain, they're essential organs. But if something's going wrong, the sperm production is going to be very sensitive to that. It's the first thing that your body's going to say, non-essential, we don't need that.
So do you think that this is almost like a screen for other problems? Wow.
Possibly. I think if there's an abnormality there's reason to say, what is going on? What do I need to improve in my own lifestyle? Not all abnormal results are going to be fixed by improving lifestyle. Some abnormalities are going to be due to things that are unavoidable, perhaps unexplained testicular failure, a chromosomal abnormality. No amount of lifestyle improvement is going to get that semen analysis up to normal.
I just want to step away from a lot of that for half a second, because it's quite doom and gloom. What about something that's a little bit more positive? Is there any emerging technology or information, new research that is actually giving us a reason to be hopeful, something that is really, really generative for testicular function for people who may be not providing very healthy samples?
It depends on what the problem is. So we would do the whole range of investigations. This is not new technology. We're looking for a chromosomal problem, perhaps something called a varicocele on the testes. You'll pick that up on an ultrasound. It's like a small bag of veins that is associated with abnormal sperm production. You look at the volume of the testes. If they're small, that's a bad prognostic sign, because it is suggestive of impending testicular failure. That's a hard one to treat. There's techniques to treat the varicocele. There's microscopic techniques to retrieve sperm from the testes, obviously under anaesthetic. And then the scientists are very skilled in retrieving the immature sperm and injecting that into the eggs to create an embryo. The techniques are there. They are perfecting the techniques all the time. In a man who has no sperm, they look higher up into the testes. This is really, I suppose, where the discussion comes in. If there's just isolated sperm, is there going to be enough to fertilise the eggs? If there's not enough, or if there's repeated failure with IVF, then there's a role for considering looking higher up in the testes. The techniques are there. Like I say, they're really just perfecting the techniques. One thing that is coming out is in a situation where, so it's the sperm is in the peripheral ejaculate, there are techniques for selecting the sperm, the best sperm to use for the fertilisation process. So there's special media that they can use to help the scientists use to select the sperm, and also magnification techniques as well.
Okay. And
that's probably something that's come about recently, actually.
And I'm under the understanding that something like varicocele is quite prevalent in weightlifters, people who...
I didn't know that.
Because they maybe overload themselves.
All right.
And it's almost a little bit like a herniated groin, but it can actually push the blood down there and cause the veins to increase in size. And it's quite common for weightlifters to have fertility issues.
So I didn't know that. And these would be men who are having drug testing as well. So there's nothing else going on.
It seems like that is quite common. So there's like people who ride bicycles.
There's room for studies there.
Yeah, definitely there's room for studies. So we've got like people who are quite into cycling. Then you've got people who are doing weightlifting. And there are activities that men can do which seem to make things a little bit more tricky to procreate. And my big question here would be, if you were to ease up on all of those things, is there hope for testicular health to get better if you've got varicocele? Or?
No. If you've got a varicocele and that is thought to be the underlying problem, it's probably not going to get better until that varicocele is treated.
Okay.
If that's the underlying problem. But for cyclists who there's a minor abnormality on the parameters, that might just be a matter of cutting back on that exercise. And that the mechanism there is thought to be overheating. So cyclists, you could potentially change your lifestyle and make a difference there. But if you've got a varicocele, if that's thought to be the underlying problem, you got to get it fixed.
I need to ask some really simple questions that might make me look silly now, but this is hopefully going to illuminate a few things for other people who are watching. Coffee. Do you have to give up coffee?
No.
Okay.
Myth.
That's a myth?
Yeah. Look, for anything, I always say everything in moderation. I mean, 10 coffees per day is a ridiculous amount.
Yeah.
A couple of coffees is fine.
So a couple of coffees are okay?
Yeah. Yes.
I'm going to show this to my wife.
See, this is part of your 3 months preparation for. Are we allowed to announce this?
Yeah, we can talk about it.
Your 3 month preparation to having a baby.
But sure,
okay,
let's put it on the internet.
Just make sure that they don't watch it.
Yeah, look, of course I'm considering it, and there are a few things that I've given up alcohol, but I've also stopped drinking coffee, and it's the worst. It is the absolute worst. Why would anyone give up coffee? I don't know. And there's it's a sticking point with my wife and I.
She wants you to give it up.
She just said, she saw it on the internet and she said, look, I think that we need to cut back on your coffee.
I'm going to say myth.
And so then I said, no, but okay, I don't want to have fights with you. So I've given up coffee, which is just a terrible, terrible thing, and I want to drink it again. So if you are saying that...
I give you permission.
Okay, that's fantastic. The other question I had that I thought was really important.
Can I interrupt?
Yes.
I love the fact that you're on this journey together. I love the fact that you're both there.
It's going to be us together at some point. And I do think that the conversation about fertility is often directed at the woman. It's like, there must be something wrong with her. But, we're taking this together as a team.
Look, even when I see women to talk about fertility issues and potentially leading on to IVF, the male partner is not always there.
Okay.
There is definitely a perception that it's a woman's problem. And breaking the news to a man that actually there's issues on the semen analysis, that doesn't always go down well. And I've certainly had to tell men that there is no sperm or an incredibly low count, and we're going to look in to see why that's happening. It's really difficult news to break. But I'm digressing. I'm interrupting what you're going to say.
No, please. I'm absorbing all this like a sponge. And if someone were to go, all right, it's time, I would like to test if I've got viable sperm. What is the process? Do you pop into a GP and then get a reference?
You could either go to a GP or you could go to see someone like me. You could even just ring our front desk at Monash IVF and I would just fill in a form. Make an appointment. We've got times set aside where the scientists would do it. You come in, they show the room where it's done. It's all very professional and everything. And then you just notify when it's finished and leave, and then they analyse it. And like I said, if you wanted to do it at home, you can do that, and you just bring it in within an hour and it's analysed. It's so easy and such a useful test.
Yeah. And if there was something that you wanted people to know, because again, male fertility is something that we don't really talk about, and the vast majority of blokes just don't really care until they have to. What is that one thing that you wish everyone knew?
As far as male fertility goes, do you know, the only thing I'm going to say is I wish that men would just have a semen analysis to find out where they are, that it's available, that it's very easy. Do you know, that's another thing that I should bring up. The number of women that I see who are in a committed relationship, they're talking about having a baby, this is their time frame, they want to get checked. And when I suggest your partner could do a semen analysis, he doesn't have any risk factors for anything, I've taken the history, they're not always keen. The answer is often, oh, we'll just try and see how we go, and if there's an issue then I'll get it done then. And my response is, I want to be able to send you away to say you're okay, this should happen naturally. But if in 6 or 12 months' time we then do the test and find out it was never going to happen, we've wasted 6 or 12 months. The thing that I wish people knew was that it's such an easy test. It's very available. Go and get it done.
I'm not sure if you're familiar with Osher Günsberg.
No, I'm not.
He's Australia's granddad of, I shouldn't call him granddad. He's dad of television. He hosted The Bachelor, the Masked Singer, Australian Idol.
Okay, I should have known that.
But Osher, he said something to me once and it really rattled me. He said that to conceive is as easy as throwing a ping pong ball through a moving car window and that ping pong ball landing into a cup. That sounds like a very intimidating and frightening chance. Can you please tell me that it's not that crazy?
I mean, I always encourage people to be proactive with fertility plans, and young people will get pregnant very easily generally. Older women will have more problems. Male fertility, we know, drops after the age of 45. So men have got, a little bit more time. It is more complicated. It is more complicated than that. The issues will, increase as people get older. And, more health issues, more issues for women, endometriosis, fibroids getting bigger, other issues like polycystic ovaries. And as I said to you, a male age, that can have a detrimental impact on semen analysis as well. It's not always as simple as a ping pong ball. Was it a golf ball?
Either or,
just landing in the right hole. At the point that, this is amazing, you go to a dark space in your head with this, the egg is released. It's sitting it's picked up by the fallopian tube by a mechanism that we don't entirely understand. And then several million sperm have been sitting there ready to go. We know that sperm can survive in the female genital tract for up to 5 days. So the sperm might have been sitting there ready to go. Several million sperm surround that egg, and they all release enzymes and break down the outer layer of the egg, and then one gets inside. And, for all of us, we had that sperm that was the first one to get inside. All of us are winners.
1 in a million.
Well, it's more than 1 in a million. That's more than 1 in a million on that one occasion. But there was an egg the month before and an egg the month before that. It's crazy. And sometimes, do you kind of think, why was it that sperm? Why wasn't it the one next to it? And it's all microscopic. It's a miracle we're all here.
I always wonder if there was a better version of me that should have got in and that I somehow bumped that sperm out of the way.
Good on you.
Because I'm a dirty, rotten, callous cheat that just wiggled his way in the egg. That I always wonder if there's a better version that should be here.
I think you're being harsh on yourself. I think you're being really harsh on yourself.
It's interesting you were saying that, for young people it's quite easy, which of course makes sense. But I want to go back to 2006 where I wore exclusively spray-on jeans, like jeans so tight that you could probably see the outline of my genitals. Yeah, they were snug. And I think we all wore that. And those fashion faux pas and those mistakes that we made when we were in our early 20s, are those the kind of things that will affect us now?
I don't think so.
Now that I no longer wear spray-on jeans?
Yep. I don't believe so.
Okay.
I don't believe so. I have never read that. I've never heard that. I've never thought about that. I think the fact that you don't wear spray-on jeans now has got more of a comment on the fact that your fashion sense has matured and moved on.
I blame cut copy and the presets.
Yeah.
But I'll move on. One of the things that we did touch on, and I would like to talk about a little bit more, is the global sperm rates going down. And you were saying that there are a few different factors that do influence that. But are there any more theories or other thoughts?
Look, they're thoughts. I have to stress this. They're thoughts. We don't know for a fact. It might be something to do with a lot of electromagnetic radiation. They have shown that it is something to do with mobile phones. Is it something to do with all the Wi-Fi going around? I don't know. One thought that I have is that hormones, estrogen, gets into our food supply, like the meat supply, and antibiotics as well. What impact does that have on fertility? I wonder. There's a strong thought that antibiotics in the meat supply can do bad things to your gut and cause pain and issues there. I wonder if they do something to fertility as well. There is something that's happening worldwide to have a detrimental effect on male fertility. A lot of theories, nothing proven, just a lot of thoughts.
This might be like completely off, but I think I read that every child that is born, male child, has microplastics in their balls. Is this something that I am now just making up and I'm just circulating misinformation
from a misinformation unit? I have not heard that. I've not read that. You know what? I don't think I can comment on that. But
do you think that microplastics could be playing a part?
I think it's possible. I think it's possible. I'm not going to discount that.
And I guess there's not much that I could do about my consumption of microplastics. But do you think that we're going to – and this I wasn't intending to get as Marvel film, but I'm going to do it.
Go for it.
Humanity. Is there a possible scenario where the future of humanity is all of a sudden at risk because we don't have enough young people to take care of our old people? Like this is the story
quite
that's being circulated.
And this is quite extreme. We know that the birth rate has fallen around the world. Like in Australia at the moment, it is less than 2. It is actually less than the replacement rate. It's the lowest that it's ever been in America. We assume that is because women are delaying having their first child, which means that fewer women are going to have 2 children because they're just not fertile long enough to be able to have 2 children. What you're suggesting is food for thought. I don't know where to go with that. Wow. The birth rate is declining. It's the lowest it's ever been. Are we going to get to a point where sperm quality, that's the trajectory, I suppose, that it's going? That's a bit of a crazy thought.
I'm just so excited seeing the cogs in your brain working because there are many different things that you could say, but they'd be very alarmist.
Well, it is alarmist, and I'm conscious of that. If you plot it out on a graph, that's actually where it's heading, but there would be a long time, before that happens. We were talking about AI and where that's going before. We're going to come home and have a robot saying, "Hi, how was your day? Do you want me to get you slippers? Would you like me to cook dinner?" like life is going to look very different, I'm sure, in years to come.
I mean, we might not even need kids. We could just have
pleasant
little robots.
We're getting very theoretical. Well, yeah, maybe. We're getting pretty theoretical here, aren't we?
So ultimately, the big takeaway here for me, at least, is yes, I can drink coffee, but mostly that if you are a man and if you do plan on having a kid at any point in your life, the big takeaway is
you
go
are part
get
of the story. You are part of the story. Go and get checked. That's
get checked.
The big thing.
And would you have any advice on what ages you should consider getting checked? Is there a window that you're the same way that men start getting their prostates checked? Is there a window of time where you should start considering getting your testicular function checked?
Yeah, I'm going to say this is something I've never thought about, never been asked. It's a really interesting question. I'm going to say in your 20s, because if if it's a significant problem like a chromosomal problem, that's not going to change, and it's going to be the same in your 30s and in your 40s. You may as well know about it in your 20s, so that if you need something done or further investigations, you can have that sorted. If it was something to do with lifestyle and there's a minor abnormality, it's something that you can work on. And you don't have to be in a relationship thinking about children to have it. Just go and get it done and see where you stand. Clearly, if you are thinking about having a baby, get tested at that point. In fact, I would say to you, get tested, and if you're fine, you know that the caffeine's been okay. That would be a way of showing it. I'm not saying 10 a day. I'm saying a couple a day is fine.
Thank you, Jenny. I really appreciate that. So one of the things that when I was really young and as a teenager, I was under the impression that if you did have unprotected sex, that woman would become pregnant immediately. That was just how we grew up. And I think that was obviously something that they wanted young people to think, because if you had unprotected sex, it meant immediate pregnancy and then your life was over. Like that was it. And now as an adult, getting closer to 40, I've been told, if you don't have kids soon, that's it.
Yeah.
And
that's such a common story as well. We spend our 20s thinking about contraception and how to stop having a baby, and then we spend our 30s trying to have a baby, and there will be some people in that age group who find out they were always going to have a problem, and in fact they should have stopped contraception earlier or maybe never needed contraception. What you're describing is the life journey. Contraception in your 20s, and stop it and try to get pregnant in your 30s. And as you get towards 40, really put the foot on the accelerator and crack on with it.
Okay.
You got to go home. You got work to do.
Woo. I'd like to say I've enjoyed myself during this interview, but I think that part of me is terrified. But one thing I do know is that after I say goodbye to you today, I'll be booking in to have my testicular function checked.
Love to hear it. Fantastic.
Immediately. I'll keep you in the loop.
Thank you so much. It's been an absolute pleasure to talk to you today.
Thank you so much, Jenny Cook.